Multiple choice question number 1.
A 42-year-old woman presents with palpitations, weight loss, and heat intolerance. Examination shows warm, moist skin, lid lag, and a diffuse thyroid enlargement. Her TSH is suppressed and free T4 elevated. Which is the initial best treatment? A. Methimazole. B. Levothyroxine. C. Radioactive iodine. D. Propranolol. E. Thyroidectomy.
A is the answer. The initial best treatment for a woman presenting with hyperthyroidism symptoms, palpitations, weight loss, heat intolerance, suppressed TSH, and elevated free T4 with diffuse thyroid enlargement, likely Graves' disease, is methimazole. Methimazole is a thionide antithyroid drug that inhibits thyroid hormone synthesis by blocking thyroid peroxidase, which decreases hormone production. It is preferred due to once-daily dosing and a better safety profile compared to propylthiouracil in non-pregnant patients. Beta blockers like propranolol may be used adjunctively to relieve adrenergic symptoms but do not treat the underlying cause. Radioactive iodine and thyroidectomy are definitive therapies, but not initial treatments. Levothyroxine is contraindicated as it would worsen hyperthyroidism.
Multiple choice question number 2.
A severe headache and abrupt unilateral vision loss are symptoms experienced by a 32-year-old lady with systemic lupus erythematosus. Tenderness is detected on examination of temporal artery. ESR levels are high. In an emergency, what course of action would be best? A. High-dose corticosteroids. B. Aspirin. C. Methotrexate. D. Anticoagulation. Or E. Observation.
The patient's presentation, sudden unilateral vision loss, severe headache, temporal artery tenderness, and elevated ESR in the context of systemic lupus erythematosus is strongly indicative of giant cell arteritis, GCA, a medical emergency that can cause irreversible vision loss. Immediate treatment is high-dose corticosteroids to suppress inflammation and prevent further ischemic damage, especially to the optic nerve. Treatment should start without waiting for temporal artery biopsy confirmation because of the risk of permanent blindness. Intravenous methylprednisolone is preferred if there is evolving or established visual loss. Otherwise, high-dose oral prednisone, 40 to 60 milligrams daily, can be initiated. Other options like aspirin, methotrexate, anticoagulation, or observation are not sufficient to prevent rapid progression and complications. Methotrexate may be used later as a steroid-sparing agent. Hence, the most appropriate immediate treatment is A. High-dose corticosteroids.
Multiple choice question number 3.
A 46-year-old man comes in complaining of joint discomfort, pallor, and exhaustion. His physical examination reveals lymphadenopathy and splenomegaly. Smudge cells and lymphocytosis are visible on a blood smear. Which diagnosis is more probable? A. Acute lymphoblastic leukemia. B. Chronic lymphocytic leukemia. C. Hairy cell leukemia. D. Multiple myeloma. E. Non-Hodgkin lymphoma.
The most likely diagnosis for a 46-year-old man presenting with fatigue, pallor, joint pains, splenomegaly, lymphadenopathy, and a blood smear showing lymphocytosis with smudge cells is chronic lymphocytic leukemia, or CLL. CLL is a malignancy characterized by clonal proliferation of mature but dysfunctional B lymphocytes. Patients commonly present with fatigue, anemia, causing pallor, B symptoms, lymphadenopathy, and splenomegaly. The hallmark on peripheral smear is lymphocytosis with smudge cells, fragile lymphocytes that break during smear preparation. Acute lymphoblastic leukemia typically presents with more blasts, or immature cells, and occurs mainly in children. Hairy cell leukemia has distinct hairy cytoplasmic projections and presents with pancytopenia and massive splenomegaly. Multiple myeloma involves plasma cells and presents with bone pain and lytic lesions. Non-Hodgkin lymphoma presents primarily with lymphadenopathy, but without characteristic smudge cells in blood.
Multiple choice question number 4.
For 3 weeks, a 62-year-old female patient with type 2 diabetes has been experiencing severe swelling in her lower limbs, along with exhaustion and frothy heron. Pedal edema is present on both sides, and the patient's blood pressure is 150 by 95 millimeters Hg. A positive result for proteinuria, 4+, was observed in the urine analysis. When making a diagnosis, which test is most reliable? A. Renal biopsy. B. Serum albumin level. C. Urine culture. D. 24-hour urinary sodium. E. Anti-nuclear antibody test.
The clinical picture is highly suggestive of nephrotic syndrome, likely due to diabetic nephropathy. The most reliable diagnostic test to confirm the underlying cause and guide management is a renal kidney biopsy, option A. While urine creatinine measurement confirms nephrotic range proteinuria and serum albumin level reflects hypoalbuminemia secondary to protein loss, these tests do not definitively diagnose the cause of nephrotic syndrome. A kidney biopsy provides histopathological confirmation of diabetic nephropathy or other glomerular diseases, essential for targeted treatment and prognosis. Urine culture and ANA testing do not address this diagnosis, and 24-hour urinary sodium is not diagnostic for nephrotic syndrome causes.
Multiple choice question number 5.
Confusion, ataxia, and ophthalmoplegia are symptoms experienced by a 52-year-old male who has a history of persistent alcohol consumption. In an emergency, what course of action would be best? A. Thiamine administration. B. Intravenous glucose. C. Benzodiazepine therapy. D. Vitamin B12 supplementation. E. Antipsychotic medications.
The clinical presentation of confusion, ataxia, and ophthalmoplegia in a patient with a history of chronic alcohol use is characteristic of Wernicke's encephalopathy, a medical emergency caused by thiamine, vitamin B1, deficiency. The best immediate course of action is prompt administration of thiamine. Parenteral thiamine, intravenous or intramuscular, is preferred to rapidly correct the deficiency and prevent permanent neurological damage or progression to Korsakoff syndrome. Thiamine should be given before or with any glucose administration to avoid worsening the condition. Other options such as intravenous glucose alone, benzodiazepine therapy, vitamin B12 supplementation, or antipsychotics do not address the underlying cause and are not appropriate emergency treatments. Thus, the correct answer is A. Thiamine administration.